Question 25, Ms Edge.
Thank you, Mr President. I'd like to ask the Minister for Health and Social Care how many face-to-face appointments were carried out by oncologists in each of the last 2 years.
Minister to reply.
Thank you, Mr President. During the financial year 2019-20, 126 clinics were held with visiting oncologists from the Clatterbridge Cancer Centre. These were either a clinical oncologist or a medical oncologist or a specialist staff grade. On average, there were 11 appointments per clinic. This is approximately 1,386 face-to-face appointments for the year. There was no significant difference in the number of appointments for the previous financial year 2018-19. Some face-to-face appointments during this time will have been lost due to a lack of transport to the island in bad weather. When this has occurred, some oncologists will endeavour to complete a telephone consultation. For some cancer types, patients would also travel to the Clatterbridge Cancer Centre for face-to-face appointments with specialist oncologists. Since COVID-19 has restricted travel to the island, the Clatterbridge Cancer Centre set up telephone consultations and subsequently video consultations with patients remotely. The majority of clinic appointments were still completed despite the restrictions, although not in person. Thank you, Mr President.
Supplementary, Ms Edge.
Thank you, Mr President. I wonder if the Minister, he's given me, I believe, the fixed statistics till March 20. I wonder if you're prepared to circulate the statistics from 1st of April to the current date, or is he saying there hasn't been any, it's all been online? And also, in previous responses, the Minister, on the 24th of November, in another place, he said that they're continuing to prioritise diagnosis and treatment of cancer throughout Nobles, including how patients continue to be monitored. Obviously, it's quite critical that patients do have an oncologist. Can the Minister therefore confirm that we do still have oncologists available at short notice to the island and that we are meeting the 2-week target?
Minister.
Thank you, Mr President. Firstly, in relation to the stats, I asked that same question myself, and the current year stats are not available yet from Clatterbridge, so I can't unfortunately circulate those because they don't currently exist, the figures to date. In relation to access to oncologists, yes, we do have access to oncologists on Ireland if required via Clatterbridge, but one of the things I do need to point out, Mr President, is actually one of the things that the actual remote oncology service has been able to do is it has allowed for specialist oncologists to speak to patients. So oncology is a very wide field, and very sadly cancers are a very wide field. There is multiple different types of cancers, and each is a specialty in itself. So by having the remote service over the period, one of the benefits we've actually seen of that is that patients have been able to speak to an oncologist that is actually qualified in the specific cancer that they have been suffering from. In relation to the 2-week target, I think all honourable members of this court know the issues that there has been around that. There has been additional resource put in, there is additional clinics taking place, and we hope to have that target back to where it should be soon. But one of the things I must say, Mr President, is we are not alone in this. In relation to the 2-week target, the UK itself has experienced difficulties as well with the way that the pandemic has gone there, and also therefore the demand on services. We equally had a pause over COVID, but we are also seeing higher 2-week rate referrals than we have seen in years.
Final supplementary.
Thank you, Mr President. I'm sure the Minister will have kept up to speed with the announcements that are coming out of the UK, encouraging people to go and make sure if they've got a new lump to get a diagnosis. As they've stated, there is no delays, that people will be seen and they realise the importance of cancer. So I'm unsure as to really what the last response there from the Minister was. But can the Minister advise, is there a waiting list within our oncology suite on the island, and are people being told it'll be 6 weeks before they can be seen?
Minister.
Thank you, Mr President. As I've said, the 2-week wait has been extended. There has in some cases been people who have had to wait 6 weeks. But as I say, that's the reason we've put additional resource in, which has not been easy to obtain, I must say, Mr President, particularly around demand at the moment, where many of the places that we actually need to contract from have actually seen increased demand themselves. And so we are bringing that back down to the 2-week wait. In relation to the comment about the UK, yes, I have seen the campaign in the UK. I think it's a very excellent campaign. but NHS England does publish all their cancer figures online, and the Honourable Member can take a look and see the weights for herself.